Good evening to all the aspirants present here. Today's topic is MRCP PACES. It's actually an introductory session, and the faculty that have joined us is Dr. Avijatri Dutta, sir. He is a consultant critical care medicine at Manipal Hospital, Kolkata. Thank you, sir. So you may carry on.
Okay, thank you so much. Now, today our session is primarily on MRCP PACES and overall view of the examination process. But before we start, it is important for us to understand what is MRCP UK means. MRCP UK is membership of Royal College of Physicians of United Kingdom. First and foremost, this is basically an postgraduate qualification. However, this is actually an entry level examination to higher specialist training in United Kingdom. Now, regarding MRCP UK, there are basically three steps you need to complete. First is MRCP UK, that is part 1. Then is part 2 as PACES. That completes the entire system, and the entire period of eligibility stands at 7 years, and for each and every part you have 6 attempts, right? Obviously, first you have to get through the MRCP part 1. Now, what does MRCP part 1 actually assesses? It basically assesses the width of your knowledge. Basic medical sciences and related questions are included in MRCP part 1. Now, in part 2, basically, they examine the depth of your knowledge, and then it comes to MRCP PACES. As I mentioned, the entire time period is 7 years. You have to clear the MRCP part 1 first. Regarding MRCP part 2, as well as the MRCP PACES, you can give anything. Suppose you can give PACES earlier, you can give MRCP part 2 later, which is a written exam, or vice versa. So the entire time period is 7 years, and the number of attempts in each part, as per as the present guidelines, is 6 attempts. Now we come back to the MRCP PACES part. Now, as you will understand, when you go through the website, it is written as MRCP or PACES Carousel 2023. Why is it so? It is because the entire system actually changed in PACES 2023, that is in the year 2023, when the new format came into place. Right. Now we go into, since our today topic primarily discusses on MRCP PACES overview of the examination format, we will mostly discuss on MRCP PACES carousel. Now, as you see from the slides, that there are basically 5 stations, right? Station 1, Station 2, Station 3, Station 4, Station 5. And there are 5 minute interval in between, and each and every station comprises of 20 minutes. So what is your total examination time? 20 into 5 plus 25, 125 minutes. Now let us go into station 1. What is there in, you can start in any station, right? So in station 1, communication station is for 10 minutes, respiratory is for 10 minutes. Station 2 is basically brief clinical consultation, which is of 20 minutes. Station 3 is cardiovascular examination as well as neurological examination, each of 10 minutes duration, which makes it 20 minutes. Station 4 is abdominal 10 minutes, communication 10 minutes, and again station 5 is brief clinical consultation of 20 minutes. As you understand, the brief clinical consultation, actually there are stations 2 as well as station 5. Now, I will suggest this is one of the most important stations. Why? We will discuss later. But this station carries the maximum marks, 28 in each station. Now, Let us come to first station number one. So, what are the clinical stations here? In a MRCP PACES carousel, there are four clinical stations: the respiratory system, cardiovascular, neurology, and abdominal system. Let us stick to these clinical stations first. For example, in respiratory system, what will you get? There is no patient communication. Once you are there, you will be given a format which is written on the wall. What is the patient suffering from? For example, Mr. John is having respiratory distress for the last 1 month. Please kindly examine the respiratory system. So, what is important in all clinical stations are first, once the bell rings, you enter. Three things: you greet the patient, introduce yourself, identify the patient, and then carry forward. For example, you enter into a respiratory station, something is written on the board. You first see what is written on the board, wash your hands, that is very important. That is very important. Otherwise, they are going to negatively score you. Then approach the patient. For example, are you Mr. John? He will say yes. Then introduce yourself. I am Dr. XYZ, whatever it is. I am going to examine your respiratory system. Is it okay with you? He will say yes. And it is very important in an MRCP PACES examination for the patient's welfare. You have to tell the patient that at any point of time, if you feel any pain or discomfort, do let me know. This is very important. This is true for all the clinical stations. For example, the respiratory, cardiovascular will have a different scenario, neurological will have a different scenario, abdominal will have a different scenario. But what is important is here there will be physical stations, so there will be physical findings. So you need to collate or collect that physical findings. So only with repeated practice on different patients of respiratory, cardiovascular, neurological, abdominal station patients. Now here, as a total, you have total 10 minutes, but 6 minutes are for you, starting to ending. At 5 minutes, they will give a bell, which will indicate that you have 1 minute left, and the rest of the 4 minutes will be discussion with the examiners. This is true for all the clinical stations, that is respiratory, cardiological, neurological, as well as abdominal stations. As you see in station number one, there is also a communication station of 10 minutes. Now, before this station, you will be given a scenario. Suppose the scenario can come anything. For example, breaking a bad news, declaring brain death, organ donation, and so on. So you have to go through the scenario, and when you enter the station, it is most likely a surrogate or some patient's relatives, could be daughter, could be son, who will be sitting, and you have to discuss the entire scenario with him or her. So this is regarding the communication scenario. Next is the consultation scenario. In consultation scenarios, basically it is how we deal with a patient in an outdoor basis when we see a patient in an OPD. For example, what you do? A patient comes to you, you take a clinical history, you do a physical examination, you explain the patients what are the possibilities, you write the management plan as well as the possible investigations. So everything is 20 minutes in brief clinical consultation, 15 minutes for you, 5 minutes for the examiner to discuss. Now, regarding this, in 13 minutes, you will get a bell, which will indicate that you have 2 minutes. Now, in both the communication station as well as the brief clinical consultation, it is very, very, very important to address the patient concern. If you don't ask about this patient concern, then you are going to be negatively marked. As in following slides, we are going to discuss about the different clinical skills which are assessed in this PACES carousel or the PACES exam. So, why most of the candidates fail? Primarily because they don't address the patient concern when you are in communication station as well as in brief clinical consultation station, and when you are not able to elicit the physical findings when you are in the clinical stations: respiratory, cardiological, neurological, as well as abdominal. Because in this clinical station, there is basically no communication with the patient. And these patients are real. You read a scenario, you do your findings, and then discuss with your examiner. Right. So now let us move on to what are the clinical skills basically they are going to assess. There are basically, seven skills: A, B, C, D, E, F, G. These are assessed in these stations. Now, if you go through the website, you will see that what is A? That is physical examination. What does physical examination mean? Demonstrating a correct, thorough, and systematic technique of approaching an examination to a patient. So this can only come with more and more practice. Next is identifying physical signs, that whatever signs you have got from a patient, for example, in cases of a patients of interstitial lung disease, you have got a fine basal and inspiratory crepes which does not change with cough. So this is one of the findings. But please do not put any findings which is not present. For example, you have not elicited any findings. It is far better to tell that, sir, I have not able to elicit any findings. I don't see there are any findings, rather than eliciting a findings which is not there. Next is C, which is the clinical communication. This is particularly true in cases of brief clinical concentration, where you take a history from the patient, do a relevant focused examination, and discuss your plan of investigation as well as management with the patient. Next come is D, which is the differential diagnosis. That is, once you have seen a patient, obviously, whatever is the system, you have to come, whether it is, even if it is a brief clinical consultation, you have to come to a diagnosis. It is always nice if you can pinpoint the diagnosis, but obviously, always it is not possible. In that case, you can obviously refer to a differential diagnosis, which you think is relevant for this case. Regarding E is also the clinical judgment, more or less the same, that addressing the patient, talking to a patient, how we are going to plan and investigate. And next is comes is managing patient concern. As I have already specified, that patient concern is very, very important, specifically in cases of communication scenarios as well as the brief clinical consultation. When you have done everything, you have to tell that, do you suppose in a brief clinical consultation? So after more or less summarizing, you have to tell, you have to, you know, put 1 or 2 minutes for this to address the patient concern. See, these are basically written scenarios, and often in brief clinical consultation, they are surrogates. They are already taught what questions to ask in cases of any concerns if the candidate asks. And last is obviously important is managing the patient welfare, which is treating the patient or the relative respectfully and sensitively and maintaining the empathy. Next, we'll go in brief about the different sessions which we are going to see in different sessions, in different, this clinical stations, the communication stations, and brief clinical consultation stations. Different skills are assessed. However, in brief clinical consultation station, all the seven skills which we have mentioned, for example, as you understand, a patient is coming to you, you are taking a history, you are doing a physical examination, you are communicating with the patient, you are addressing the patient concern as well as the managing patient welfare. So everything starting from A to G, that is physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patient concern, and managing patient welfare. So all of these seven skills will be assessed in station 2 and station 5, that is brief clinical consultation. And obviously in clinical consultation there will be A, B, D, E, and G. That is physical examination, identifying physical signs, ultimately forming a difficult differential diagnosis, clinical judgment, and patient welfare. Now let us just go through the same things. For example, in station 1 and station 4, you have communication encounters, right? In station 1, along with respiratory system for 10 minutes, you have communication for 10 minutes. And in station 4, you have abdominal system for 10 minutes and communication for 10 minutes. So as I have already mentioned, that written instructions for the case are given to the candidate during the 5 minute interval, which is in between the station. 10 minutes are allowed for interaction. Mostly there will be a surrogate, right? Either patient's daughter, patient's son, or someone. And there will be no examiner candidate interaction. And marks will be based on examiner observation alone. So, what are you expected to perform? So obviously guide and organize the interview with the subject, explain the clinical information, apply the clinical knowledge, including knowledge of ethics, and treat the patient or the patient family members with dignity and respect. This is for the communication stations, which is there in station 1 and station 4. Now we go to the brief clinical consultation. We have already discussed this. Thus, you will receive a short note or a referral letter from the GP, and you will read it during the 5 minute interval. And for each session, there are 20 minutes. 15 minutes are allowed for history examination and discussion with the patient, followed by 5 minute question and answers with the lead examiner. Now, as I have already told, after 13 minutes, you are going to have a bell which will indicate that you are, 2 minutes shy of meeting the examiner. Now, always when you read the scenario which is given to you, it is always nice to write the possibilities, but keep an open mind because something new might be there when you are going to approach the patient or take a history. This is for stations 2 and station 4, which are brief clinical consultation. Now we go back to the clinical station or clinical system examinations, which is the station 1, the station 3, as well as the station 4. As we know, station 1 has respiratory system examination, station 3 has cardiovascular and neurological system examination, and station 4, the abdominal system examination. As I have mentioned you, whenever this is a scenario, you are not going to get any scenario outside. It is only when the bell rings and you enter the room, you will see a scenario which is pasted in the wall. So you go, read the scenario, wash your hands, go to the patient, introduce yourself, identify the patient's identity, right? That is very important. At the same time, always mention if you have any pain or discomfort when I'm going to examine you, do let me know. So, what are they looking here in this clinical system examination? So, comprehensive and correct physical examination technique, ability to detect physical signs, ability to construct a differential diagnosis, ability to suggest sensible and appropriate treatment and investigation plans when you are going to discuss with the examination, and always ability to treat a patient with dignity and respect. Always these mostly comprise of all the stations you are going to enter in or encounter in MRCP PACES examination. But always remember in this MRCP PACES examination, basically, as you understand, in the new format, the total pass marks has been set. A total is 168 and the pass marks is 126. But you have to pass all the stations as well as all the individual skills. If you go through the mark sheet or the format which they give, you will see there are different stations, communication station, respiratory stations, which we talked about. So including that, you have to score 126, as well as for all the signs or the which they are basic, for example, physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patient concern, managing patient welfare. I mean, all the skills which are judged, you have to pass them also. So it is not only, passing the individual stations is good enough, but also scoring minimum marks, that is the passing marks for all the skill stations, are also equally important. So this is more or less a nutshell of MRCP PACES examination overview. Now, if you people have any questions or any queries, I am very happy to answer.
Aspirants, if you have any question regarding MRCP PACES, please do ask.
Hello?
Yes, ma'am, please.
Yes.
Yeah, I just wanted to know that 7 years cap has been taken up, right? Now the time limit of 7 year is not there. Am I right?
Yes, 7 years is there. 7 years is there. From MRCP part one, when you pass the exam, to the clearance of MRCP PACES, the total duration is 7 years.
No, no, that 7 years duration cap has been taken off. It's not there, I think so. I have asked in other group also, but because you mentioned
Now,
that, that's why I'm clarifying again.
as far as to my knowledge, and even to the last eligibility criteria, regarding you have to clear the entire duration starting from 1, 2, as well as the PACES in 7 years.
No, sir, that cap is not there.
And each
Uh,
and each and every and each and every attempt and each and every step, you have 6 attempts.
Sir, the number of attempts are six plus one additional, but the
So that is
duration.
one additional depends, and I'm just clarifying. Now, most of us are likely to clear by 6 attempts. It is plus additional one attempt, but that is signature from the supervisor and ABCD, who is your basically mentor and the guide at your institute. They will consider.
Okay, sir, but will you please verify and let me know if the duration is that limit is 7 years, because that has been taken up and I have
Yeah,
called.
I'm very sure because
No, no, I have called in the UK
because
MRCP
even
department,
hmm,
and they have said that there is no 7 years
hmm.
what to say cap currently. They
As
have taken it
madam,
off because the
what can I tell? I've not called. I'm telling you, I'm telling you, ma'am. The point is, I have not called the MRCP UK department there. I agree, but the point is,
Hmm.
even if it's the last eligibility criteria, what was posted in the MRCP UK website mentions the
Hmm.
same. But I will definitely call them and give you an update.
Because sir, I have passed my part 1 in 2017, and then I did MD
Okay,
anesthesia, and I was like
okay,
my duration had finished in the this year only, in June
okay,
July. But because
okay,
I want to attempt the paces now, so I specifically inquired
okay,
2 3 times, and I
okay.
got it clarified that
Hmm.
the duration
Okay.
of 7 years has been taken off. So will you please ask
Okay.
and find it out and
Yeah, I will
clarify?
definitely. I
Yeah.
told you, ma'am. The point
Hmm.
is, what was even there in the last eligibility criteria was that see that things do change, right? Over a period of time, things might change, right? So definitely, I'll clarify with them and get back to you. No issues in that.
Okay, sir. Because then only, I mean, I have asked in other PACES groups, they have said that
No, no,
there
no.
is
You
no
have told
7 years
me
limit.
specifically. I'm telling you, ma'am. You
Hmm.
have told me specifically that you have called them, right? And if they have told this, that should also be available in the website. So don't worry at all. We will
Yeah.
definitely contact the MRCP office and get a clarification on the same. Things might change over a period of time.
Okay, sir.
Because as I was speaking in the paces to 2023 to 3 right? Something else
Hmm.
was there before. So things do change. I fully agree and appreciate, and it is nice that I will also contact. If something has changed, they should also notify me, being an now a RCP member and a FRSB member, right? So I will call them. No, no
Okay.
issues then. I'll contact back to you. No issues.
Okay, sir. Yeah.
Okay.
Hello, sir.
Yes, please.
Good evening, sir. Sir, I just want to
Good evening.
know the page which has been the page which is open now,
I
which
couldn't
shows
hear you.
station
Please.
one. Hello, hello, sir. Can you hear me?
Hello. Yes.
Yeah, sir. Can you hear me?
Yeah, yeah. I'm hearing you. Please.
Yeah, sir. The page which is open now,
Yeah,
will
I
the
can hear
pages?
you.
Yeah, will the pages new format is as per this order? The communication, respiratory examination, consult.
The paces the paces format which we discussed, even if you go through the website, is
Uh-huh.
paces 2023 carousel. So they have changed it something. For example, before 2023, the brief clinical consultation used to be of 10 minutes. Now, due to
Uh-huh.
certain reasons, they have changed it. We are not going into something which was before 2023, because
Mm,
this is what the new format is, and which is
mm,
running for the last maybe 2.5, almost 2 years now. So currently, this is the format where you have 5 stations. Station one is respiratory 10 minutes, communication 10 minutes. Station 2 is BCC, that is brief clinical consultation for 20 minutes. Station 3 is cardiological examination and neurological examination of 10 minutes each. Station 4 is abdominal as well as communication, is each of 10 minutes each. And station 5 is brief clinical consultation of 20 minutes, and you have 5 minutes interval in between.
Oh, 5 minutes interval between each station, or
Yes, yes. Station one composite 20. Each station, if you see, even in the website, 20 minutes. Right. So
oh,
station
oh,
one, you enter respiratory, you go to communication.
mhm,
Most of the cases they are in same rooms, separated by curtains. So
mhm,
only after station one, you come back. There are 5 minutes interval. Station two, post station two, 5 minutes. Station three, which is a combination of cardiological as well as the neurological examination. After that, so they are often, as I told you, with the curtain, one patient's lying this side, one patient that side. So 10 minutes, 10 minutes. You come out, 5 minutes interval, and you go on like that.
okay, sir. Okay, okay. Sir, can I ask in brief clinical consultation how it's different from this abdominal examination or system examination? In
See,
brief clinical, we have to do entire
in
thing.
clinical I'm telling you, in clinical encounters, be it respiratory, be it suppose cardiological, neurological, or abdominal. So there is no communication with the patient, no communication at all.
In which one,
The
sir?
point is the bell rings. I'm telling you, the bell rings. You
Uh-huh.
enter the room. There will be a scenario which is
Mhm.
posted in the wall. Suppose this patient is abdominal
Okay.
distension. You read scenario, wash your hands, come to the, suppose it could be a patient of ascites, CLD, whatever. You
Mhm.
come to the patient, introduce yourself, take an identity of the patient. Am I talking to XYZ? I am Dr. ABC. I am going to examine your abdominal system. At
Mhm.
any point of time, If you feel any pain or discomfort, do let me know. So there is no communication with the patient after that. You do your
Yeah.
examination thoroughly,
Mhm.
systematic wise, and after you have exhausted your 6 minutes, 5 minutes, a bell will ring, which will indicate that 1 minute is left. And once your 6 minutes are over, you will face the examiner. The examiner will ask you what are the positive findings you have got, what is your diagnosis, how you are going to investigate this patient, and what is your management plan. More or less, this is the format which runs. This is
Mhm.
for the clinical situations. For example, the systems we mentioned:
Mhm.
respiratory, cardiovascular, neurological, abdominal. Now, in brief clinical consultation, is something like when you see a patient in an outdoor clinic, an OPD. Suppose
Mhm.
the patient comes to you, you take history from the patient. Based on the history, you do a focused examination of the system to which the patient is complaining. So the basic difference is, in BCC there is direct patient or surrogate communication. It might happen that in examinations real patients may not be there, but there is a surrogate who has been taught what to tell, what not to tell. So you take a history from the patient, do a relevant examination, and then face the examiner to understand what could be the possible causes, diagnosis. And it might happen that you can go systematically and the examiner will tell you no, nothing is there. So in clinical situations there is no interaction with the patient at all, apart from
Mhm.
greeting, introducing, taking an identity, making
Mhm.
sure that at any point of time you have any pain or discomfort, you let me know. Brief clinical
Mhm.
consultation, just as we see patients in outdoor. Patient comes,
Mhm.
you take a
Mhm.
history. Suppose I'm complaining of cold and cough, I'm having shortness of breath. So your primary focus is the respiratory system, not the
Yes.
abdominal system. You can obviously go around if time permits, but that is how it happens. So you have a direct communication with the patient in BCC, which is not there in clinical encounters.
Fine,
I
sir.
think I'm clear.
Yes, sir. Yeah, perfectly clear. Thank you, sir. Thank you very much for your.
Thank you. Thank you. Thank you. Any other
So,
questions?
so earlier, this station 5 had 10 minutes in which we had to examine and also
Yes,
tell
yes,
the management, which was very tough actually.
correct,
And
correct,
now I
correct. That
think
is why
they
they have
have,
changed.
yes,
Absolutely.
because
A-
in those 10 minutes we
Absolutely. What they have
actually have.
told, what?
Hmm.
Yes, yes, please,
So what I'm
please,
trying
ma'am.
to say is that
Hmm,
I think they have included the history taking and then the management part. I mean,
hmm,
diagnosing, and then
hmm,
talking about the
hmm,
management. Everything is
hmm,
included in
hmm,
the news station.
hmm. No, the point is the station remains the same.
Hmm.
The way it was changed, that the MRCP UK people who are the examiners or in the board, they basically felt that, as you told, ma'am, regarding a 10 minutes BCC station is very difficult to take a history as well as identifying the problems or identifying the signs, and then going into discussion with the what did happen during those 10 minutes. 10 minutes with you, 2 minutes with examiner, right? So, and in communication there were 20 minutes. 15 minutes you discuss, 5 minutes with the examiners in communication. So they have told they have why they have changed. Regarding the communication station, there is nothing much you are going to add, right? Even after discussing with the patient. So that is why the communication stations have been cut. But 10 minutes, two such. And brief clinical consultation, if you put it as 20 minutes, so that is good enough. That is how we deal with patients day in and day out in an OPD. And it gives you ample time to take history, as well as to do a focused examination, as well as discuss the possible, the investigation or management plan with the patient as well as with the examiner. But always remember, because even in those 10 minutes, you have to always identify what was the patient concern. That was difficult. The time was too constricted for having a really a clinical consultation. So, but however, in clinical consultation, whatever you do, however you practice, always mention, always ask whether there is any concern, and there will be concerns, because that is how the surrogates are taught. And in BCC, mostly they are surrogates. As in clinical stations, they are real patients. There is no communication. There is basically, go greet the patient, examine, and do. But in BCC, mostly, and they are being taught. Obviously, there will be one, two, 3 points of concern. If you don't address them, you are going to lose 4 marks in total.
Right.
So, I'm not very sure. I should have been asked, should have asked earlier. The people whom I am talking with, are they going to give PACES soon? I heard that seats are very difficult nowadays to get.
Yes, sir. Planning in the next couple of diets.
Okay, okay. Now, how is the scenario if people are getting, seats? Because, with this, this is I mean, really privileged to have with Farz Academy. Now we have also going through multiple courses. Now, what people was telling me that it is really difficult nowadays to get a seat in a particular diet of your choice. Is it true?
Sir, I think getting UK seat is easier than getting seat in India. But only issue is that
Okay.
we don't have practice. I mean, we don't have practice over the UK patients. So that's why people try
No,
to take it in
it's not
India
it's not
itself.
no,
Huh.
no, it's not only the UK patients. You understand, ma'am, that as the geographical location changes, the frequent patients, for example, CLD, chronic liver disease, is very common here, right? For example, if you give an examination in UK, so DVT, deep venous thrombosis, is very common. It is not that common in here, right? So I think it is always better to give examination, because right now India has many centers. Still, we are having these problems, right? There have been many, many, many centers opened up. And when I
Yes.
give my examination, it was, I think, hardly 8 or 10 centers. Now, when I go through it, there are multiple centers, multiple centers. So I would advise, it is always wiser to give examination in a center or in a geographical area where the case mix is known to you, more or less. If the case mix is different, then things can be a bit tricky.
Yes. So the number of candidates are also increasing day by day. That's why getting
Right,
seat
right,
has
right.
become difficult.
Okay, okay. But the point is, everyone will get a seat. Nothing, nothing to worry in that. Right. It's better if you don't get a seat this time. Continue the practice, because I will tell you from my personal experience. মানে, the point is कि unless you practice well, you will not be able to identify the physical signs, which is very important in the clinical examination scenarios. Because you have this time burden of 6 minutes you have to complete, right? It is only with practice you have to go systematically, do all the examinations, and then identify or pick up the signs which is there. So that can only come with practice. If you don't get a, seat this diet, maybe it is a blessing in disguise. Maybe you get more time to practice on patients, practice on different scenarios, which will help. Because always remember, what does PACES mean? They say PACES is: P is practical, A is assessment, C is clinical, E is examination, and S is skills. So, practical assessment of clinical examination skills. They are clearly telling you, we are not going to go through, any theoretical discussions here. We have already seen you in part one, part two, about your breadth of knowledge, about your depth of knowledge. Now we are trying to, examine you on the clinical skills which you own. So this is primarily a clinical examination. All the things will ultimately culminate to what is your findings, what are your differential diagnosis or the differential diagnosis, how you are going to investigate the patient, and how you are going to manage the patient. As simple as that.
Yes. Sir, also one just suggestion I wanted. Like currently
Yes,
I'm
yes,
doing
definitely.
yeah, SR ship, that is the bond in anesthesia department, because I
So,
just
hmm.
finished MD anesthesia. So the
Ah,
thing is that I am like, even though I'm working in OPD for a PAC, like pre anesthetic checkup, so I don't get to
hmm.
see all the classic cases of medicine, and my whole
Yes.
day goes in that only. So how, and I don't have any study partner, because usually in anesthesia people
Hmm.
prepare for this EDIC instead of
Hmm. Eddie,
MRC,
Eddie,
EDIC,
right.
yeah.
Hmm.
So the thing is that I wanted to know how I can include preparation of PACES, and also I have this gap of almost 7 years between my
Okay. Hmm.
uh,
Part one, as you
MRCP
told
part
me.
1, part 2,
Yeah,
and
yeah, as you
this
told me.
spaces. So I want
Hmm.
to ask you, like, how I can, just start it off. My this thing bond will end next year, April. So in these
Okay.
4 5 months, how can I, I just, start building the base, so that
Hmm.
immediately, at least in the second diet of next year, I'll be in a position
Hmm.
where I can, prepare well, and, just get done with.
Two things, ma'am, I'll suggest. Number
Hmm.
one is in this MRCP PACES examination, there is no alternative to practice. Now, what is practice? Obviously, you can get practice only on medicine patients, right? Who
Yes.
have, suppose, a cardiovascular. So, wherever you are right attached or you are doing an SRship, so always have some time on a daily basis. It may be 1 hour, doesn't matter, but the point is, you have to go to the medicine areas to see otherwise, you will never able to elicit the science. You will never be confident. That is part one. Another thing which I can suggest you, that during this period to get a grasp, because as you told me, ma'am, that it is already 7 years or more, part one, part two, you are
Hmm.
already quite a time which is you are away from this medicine sort of patients. You are primarily dealing with anesthesia patients. So what I can suggest, you can obviously take a short, course. There are different
Hmm.
PACES courses running, including, the Farz Academy also does it. So wherever you
Okay.
want to do, that will give you a grasp and an idea before starting. See,
Hmm.
what
Hmm.
are the things which are basically, asked in PACES? What are the different types of patients? For example, in cardiology, obviously there are different, most of the scenarios or most of the centers will have valvular patients, no doubt, but the most common is valve replacement patients, because they are the most easiest to get. MVR,
Yes.
DDR, whatever, multiple, dual valve, as you understand. So because the point is, since you are already, a few years already, a gap in the sense that you are not dealing with medicines patients. So I think it is
Yes.
best you get a good, wherever you want to do a practical course or a practical session to more or
Hmm.
less identify because what happens in this practical sessions, or the practical courses which happen all over India, they give an insight of different sort of patients which are mostly asked in the examination. 90% of
Hmm.
the patients come from them. Different scenarios.
Yes.
It could be ILD, COPD, suppose in ascites, how to examine it. Now, because you haven't done it for quite long, examination technique is also very important. How you are going to approaching a patient, doing a physical examination, identifying signs comes later. First is,
Right.
how is your approach? Whether you are examining it correctly, systematically. So, what I'll suggest, ma'am, since it is quite a whatever whatever you want to do, the point is
Hmm.
first take a. Suppose you are not going to sit for the exam, you are just going to get a grasp on overall
Yes.
how
Hmm.
clinical examination is done in medicine patients within this time period. You have to understand, in clinical scenarios of an MD medicine, you get 20 minutes. You take history, do examination, discuss with
Yeah.
examiners for 5 minutes. But here the time is very important.
Limited.
6 minutes. 6 minutes. You have to cover everything. So what are the things you have to go through? That you can only, I think, will get with a good course anywhere. And these people are doing wonderful courses. As I understand, even in the last time, they had a 70% clearance in PACES. That was very good.
Yes. I think because of the gap, it's better for me to, just attend this 3 days course to get a hang of it and then,
Now,
start applying
yes,
them
yes, yes.
on a daily
Yes,
basis.
ma'am. What will happen, even if you go to your medicine ward and even examine the patients, you have no clue, since you told me you don't even have a study partner who may be
Yes.
from medicine or somewhere. So you will
Hmm.
be a bit haphazard. In six
Right.
minutes, how I'm going to approach, what things I'm going to see. Obviously, just doing a course will not make you very good. But once you learn the techniques and you apply the same on the patients wherever you are, in whichever hospital, so that will make you more confident. You yourself will be able to elicit signs. There is no
Yes.
magic thing out here. I think
Yes,
ma'am,
sir.
that should be the best for you, since there is a quite a long gap period and you are not from the field of medicine. So I think that
Hmm.
will definitely help you.
Yes, sir. So when is your next hands-on course?
So I'm not very sure that maybe these people Fatima will be able to tell you. You contact her.
Okay, sir. Okay, no problem.
Well,
Take care.
ma'am, we are having the hands-on training course on 13 to 15 Feb 2026.
Okay, that is for
Oh, that's
that
great. That's
first,
great.
but then that will be too late. No, now it's November.
Yeah, ma'am. Now it's November, December, January at Feb from 13 to 15.
No, what happens? What happens, ma'am? I'm telling you, I understood her version. What happens, ma'am? Most of the courses
They
actually
are
happen,
designed during
when the
the,
examination diets are there, because most of
exactly.
the candidates, they want
Hmm.
to you want to get feel of the real cases, and whether most of them are maybe prepared, and maybe I'm trying to honing my clinical skills, how I'm going to do it. There obviously are a few candidates who actually come and have a feel how things are done, but that is how this is placed, because most of the, if you go to most of the PACES diet are, I have not checked it, but most likely are placed after that. Maybe February, after that you have multiple
Yes,
PACES
yes, I get
diet all
your
over
point,
India,
sir.
most likely.
Most of the
Most likely.
coaching they'll conduct the classes during that period only, so that just before the exam,
Yeah,
we are
but
exposed to maximum cases. Yeah.
right, maximum practice, maximum whatever tweaks you need to have. But whatever I'll suggest you, ma'am, whatever, it's not that you have to do it out here. Wherever, take a course, it will be really helpful for you.
Okay, and sir, I
Because
think. Hmm,
these courses which are close to exams, there are two benefits. Number one, obviously you will interact with the faculty members who are obviously trained. They are doing so many courses out here to have an idea or interaction. Number one. Number two, obviously you will have many colleagues who may be at a much higher level than you regarding the proficiency of examination and skills. So learning
hmm.
is endless. Not only the faculties, you can even hone something from your colleagues, because most of them in these scenarios are going to give exams, maybe the next maybe somewhere in
Yeah,
Chennai,
so
in
they are
Kolkata,
already
wherever.
prepared. Yeah.
Right. They are already prepared. So when you
Hmm.
discuss with him, you make suppose a sort of a group. So it will definitely help you. Maybe you are going to give maybe 6 months down the line. That doesn't matter.
Hmm.
It is ultimately the information we are going to gather and the knowledge that will help us pass.
Right, sir. So you are suggesting that it's better to take like the actual hands-on rather than the
Yes,
video
yes. Because
lectures,
what
right?
happens?
Huh.
No, video lectures. I think it's all because what happens in hands-on, you have what is the benefit of a hands-on? The most important benefit, you see a real patient, you examine
Hmm.
the mistakes which you are doing are pointed by the faculty members where you are going to wrong. You have a feel of how things are being done. Video
Hmm.
lectures are good, but that is not because if it's not possible for me, I'm so busy, it's not possible for me. Okay, it's fine. But for an individual, I will always advise to go for a hands-on course that gives an entirely different feeling. Putting your stethoscope, suppose in your cardiological patient, putting your stethoscope and listening to a murmur with your ears is something different. You will identify it. Suppose in a video course, they will show everything, where to place, where not to
Yeah.
place, fine. But your own feeling that I have heard it, I have identified it, I have examined the patient systematically in those 6 minute period. See, in a video, you can rehearse, okay, point one, point two, point three, point four, point five, point six, how they are going examining. But I'm very sure because I have done so many courses now. When you come to a real course, that 6 minutes will go to 10 minutes. Because with
Right.
practice, what happens, you don't have to remember. Otherwise, what will happen? ये पहला step था, अच्छा वो दूसरा था, ये तीसरा था.
Hmm.
That was because you are what is happening? You are putting your
We are
brain
using
into
all
what
our
are the things you
senses.
need to do.
Hmm.
You what you want to do, and with that, what happens? You miss the physical science because your main is too much blocked in. What are the steps I have to do? One, two, three, four, five, six, seven, eight, nine, 10. But missing the physical science. But when you practice on a real patient and take it back to your center and practice into to all other medical patients out there, that is an entirely different field.
Right. Okay, sir. Got your point.
I
Hmm.
No, no. I think you're so enthusiastic. I really, really liked the way you spoke. You have cleared your MRCP Part One in 17. There is no point in dealing further. I will just advise you to join the course whenever it is. What Sana told, I don't know the exact dates, but please do join. I think it will be really helpful to you because 17 and 25 is already 8 years. I will
Hmm.
definitely, as you told, I will definitely contact them regarding this, whatever is this fiasco of 7 years or not. You have individually contacted, that's fine. Maybe they have removed it this year. But whatever it is, clear it. There's no point in continuing forever.
Yes, sir. That's what even I want. And honestly, I
No, no,
like
that's really
medicine
good.
more
Really good. I
than
appreciate.
medicine more than anesthesia. It's just that I didn't get DNB medicine in my place, so I took anesthesia as a backup plan. So I always wanted
No,
to
no,
do
no, no,
medicine
not,
only. Yeah.
no, 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 nothing to worry, nothing to worry. See,
Hmm.
in Manipal Hospital, I am a consultant in critical care medicine. I have
Hmm.
done acute medicine, UK, MRCP, UK, SC, all the stuff, and also done IFCCM, IDCCM, European diploma. I was the topper. I am into critical care medicine. I practice critical care medicine, but my heart
Hmm.
is still with medicine. So nothing to worry in that. So whatever
Okay,
you are
sir.
doing, you are doing great. In anesthesia, anesthesia is a very good field. You are doing great. So nothing. I'm in critical care medicine. So what? So I have done ADIC. I was the topper. I told you. IDCCM, IFCCM, all this stuff. But I also did things in medicine. So nothing to worry in that. Nothing. You're doing great.
Okay, sir. Thank you, sir.
Thank you. Sana, if you don't have any questions, we close the session. Hello,
Hello.
Sana. Yeah, I was telling you if you don't have any further questions, we can close the session.
I had just a query, sir.
Okay, sure. Please.
Yes, sir. So I just cleared part two in April of this year, and
Yes.
I've gotten a seat for New Delhi in Diet One for 2026. So I've signed up for
New
the
Delhi in
New Delhi of Diet One, 2026. Next
2026. Okay, when is the date?
end of 26th February to 1st March.
Okay,
Yes, sir. So, sir,
okay,
I'm actually from MD dermatology background. So, I my knowledge of general medicine is very theoretical. Whatever I have done is theoretical in the part one, part two. So, I want to give the exam in the
okay,
same momentum so that I don't forget the theory. So, I got the seat luckily, and I've joined a consultation and the communication course online, but mainly for the clinical skills, I
okay,
joined this mock test and the 3 day course. So I just wanted to know
okay,
which hospitals should I'm a senior resident in National in Chittaranjan, and I wanted to know what are
okay,
the cases and which hospital should I visit to see mainly the physical eliciting the physical sign, because that is my biggest worry.
okay. So you are primarily worried about the clinical stations, I guess, right?
Yes, sir. Yes. So I
Okay.
can do the
So you tell
examination
me,
after.
I'm putting a question. You tell me in respiratory system, what can be the cases, possible cases? Tell me.
So bronchiectasis and COPD and lung cancer.
Yes, the most commonest will be COPD and interstitial lung disease. Bronchiectasis,
Okay,
everything will
interstitial
come.
lung
There
disease.
is
Yes, sir.
because what happens in scenarios they give pneumonia and all the stuff, but that hardly comes in examination because in big pneumonias where
Yes,
you
sir.
have signs, mostly the
Yes, sir.
patient is sick,
Yes,
so
sir.
they are not going to give you. But the point is, what will they can give? Suppose in a patient of ILD, you may have rheumatological changes in the hand.
Yes, sir.
Understood?
Hmm.
You may have steroid purpura.
Mhm.
So because the patient is on long-stand steroids. So regarding the etiology of the possibility,
Mhm.
see any government college would be good. Are you practicing? Practicing in the sense not regarding dermatology, regarding these clinical stations.
Sir, yes, but I'm not practicing on patients. I'm practicing at home the steps of the examination. But I'm not sure whom to
No,
approach
no, no,
for
no. Please,
the.
it's because what happens if you don't practice on
Hmm.
patients, how will you identify the
Yes,
signs?
sir. So that's why I was thinking to whether to do it in a specific hospital, any like because the cases are not found in all the general medicine wards. So
See,
I'm.
honestly speaking, you understand, I am from a private hospital.
Mhm.
But the point is, any government hospital, you have loads of cases
Okay,
for
sir. Okay, sir.
abdomen.
So
What
I
will
will
they give?
approach the
They will ideally
concerned
give
department. Okay, sir.
TLD, ascites. Very important is don't miss the, CKD patients.
Okay, sir.
Fistulas, transplanted kidneys are very important for
Yes, sir.
abdominal cases.
Okay,
And
sir. Okay.
obviously, I will also suggest you before you go into the exam, do a mock
Mm-hmm.
course, do a course, hands-on course, not
Yes, sir.
online course.
Yes, I've thought about it.
Wherever you want, wherever
Mm-hmm.
you want,
Yes, sir. Yes.
wherever you want.
Mm-hmm.
Please do because it will help you, identify different things which you miss. Because, for
Yes,
example, I'm
understood.
telling you an example. In the last course, I'm just giving you an example. In the last course, as we do when we examine, suppose the cardiovascular system, when we put a stethoscope on the heart, suppose
Mm.
S1 and S2, do we really put our fingers on the neck? No.
No, yeah.
Do we
Mm-hmm.
do when we do it? But the point
Mm-hmm.
is, in examination, if you don't put a finger, for an example, on the neck, so
Mm-hmm.
you don't know what is S1 and what is S2, which is love
Yes,
and
sir.
which is dove.
Mm-hmm. Yes,
So
sir.
I will also, no, no, you do it in any government hospital, but always, 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 since your, year is on February last or March 1st regarding the
Mm.
examination date, I will always advise
Yes.
you to do a mock. That will change your entire vision. That will, and
Yes, sir. Yes.
will be able to fine tune you before the
Mm.
examination. Because देखिए ये एग्जामिनेशन में सिर्फ आपका जिसको बोलते हैं कि एफर्ट एनर्जी पैसा भी तो इन्वॉल्व है ना बहुत पैसा लगता है
Yes, sir. Yes.
मोर
Yes,
देन
sir.
अ लाख
Yes, sir.
so you
Yes,
give
sir.
your best shot that is my
Yes,
advice
sir.
nothing
Yes.
else
I'm trying.
ठीक है
Yes, sir.
thank you
Okay. Okay.
thank you
Yeah. Okay, sir. Thank you so much. Thank you so much. Yes.
thank you so I guess we have no more questions.
Yes, sir. So we can conclude this session. And also to all the
Okay.
aspirants who are wanting to join a course, whether it's hands-on training or an online classes, we do have online session too, which will be done in every Fridays. Also, there will be a hands-on training. So for more information, you can text me in the number. Thank you. Thank you,
Okay,
sir.
thank you so much everyone.